Welcome back to this lesson on clinical reasoning in prime care nursing practice. We shall continue with our topic on principles of clinical reasoning. In the previous video, we discussed the meaning of clinical reasoning, which is a continuous cycle where clinicians collect data, interpret findings, recognize patterns, prioritize risks, take action, and reassess to ensure safe patient care. It requires thinking ahead by asking what is happening now and what could happen next if no intervention is made. By the end of this video, you will be able to formulate a clear problem statement from a patient's history and findings. You will also learn how to select the most likely causes of a patient's presentation using evidence from the clinical data provided. Let's begin with the lesson by finding out how we can write a strong problem statement. A strong problem statement organizes scattered clinical data into a clear, concise escalation message using the ISBAR framework. Instead of listing findings, ISBAR turns information into a risk-focused clinical picture. Now, let's look at the qualities of a good ISBAR-based problem statement. I stands for identification. This is where you describes who the patient is. It includes the patient age, relevant background, and location if needed. S stands for situation. This is where you describes what has changed or what is currently happening. The next is B. B stands for background. This includes relevant clinical context or history. A stands for assessment. This describes the key abnormal findings, which are vital signs, symptoms, trends. Next is R, which stands for recommendation. This is what is needed, such as review, escalation, intervention. Lastly is another R. R stands for readback. This is the confirmation of the plan. Let's see the core structure of an ISBAR problem statement. A strong problem statement follows this structure. Start with the presenting concern. Then state the key abnormal findings. Next, describe the clinical risk or trajectory. Finally, give the required action. Here's a simple example of an ISBAR problem statement. For identification, adult patient on the medical ward. Situation: new onset of shortness of breath. For background, previously stable, now with worsening fatigue over the past few hours. Assessment: respiratory rate is 28 with increasing work of breathing. For recommendation and risk, high risk of deterioration which requires urgent medical review to determine underlying cause such as hypoxia, sepsis, metabolic acidosis, and prevent further decline. Let's look at the advantages of using ISBAR. One of them is, it reduces vague communication. It makes risks more visible. It supports prioritization. It also justifies escalation. And most importantly, it improves patient safety. Please note, a strong problem statement does not just describe findings. It communicates urgency and trajectory clearly. Now, how do we choose the most likely cause using evidence? Advanced clinical reasoning does not treat numbers in isolation. It links findings to mechanisms. It asks, what mechanism could explain this finding? Which system may be failing? Is this compensation or decompensation? For example, tachycardia could reflect pain, hypovolemia, hypoxia, infection, or anxiety. Hypotension could reflect from reduced cardiac output, vasodilation, or fluid loss. And altered mental status could reflect to hypoxia, hypoglycemia, sepsis, or reduced brain perfusion. Always use the clinical data provided to justify your most likely causes, not assumptions. In summary, a strong problem statement uses the I-SPAR framework to turn scattered clinical data into a clear, concise, and risk-focused message. It includes identification, situation, background, assessment, recommendation, and readback. We also talked about the core structure of an I-SPAR problem statement, which combines presenting concern, abnormal findings, clinical risk or trajectory, required action. That will be all for now. We shall continue the lesson in the next class. Thanks for watching. See you in the next lesson.